Today we're going to talk about a silent warning your body might be sending you. It's a message that seems to come from your liver, but it's really about your heart. I mean, think about it. What if one of the most common liver conditions in the entire world wasn't actually about your liver at all? What if it's a secret message, a major warning sign about the health of your heart? We're talking about a condition that affects a huge number of people. And honestly, most of them have no idea they even have it. And just to make things a little more confusing, it recently got a brand new name. So yeah, let's clear all that up. Okay, first things first, what in the world is MASLD? Let's unpack this new name and figure out what it actually means for you and your health. So you might have heard of something called NAFLD, or its more serious version, NASH. While those names are out, the medical world recently updated them to better point to the real cause. So NAFLD is now MASLD, and NASH is now MASH. See that? M. It's there for a reason. It puts the focus squarely on metabolic dysfunction. So what is it really? Well, at its most basic level, MASLD is when fat, specifically a storage fat called triglyceride, builds up inside your liver cells. The really important part here is that this is happening to people who don't drink a lot of alcohol. And you have to know MASLD isn't just one thing. It's a spectrum. On the milder side, you've got simple steatosis. That's just fat in the liver, not much inflammation. And the outlook is generally pretty good. But if it keeps going, it can turn into MASH. And that's when you get inflammation and real damage to your liver cells, which seriously ramps up the risk for scarring, cirrhosis, and even liver cancer. But here is the sneakiest part of this whole thing. For most people, MASLD is completely silent. No symptoms, nothing. People feel totally fine, which is why it usually gets discovered by accident. You know, maybe from a routine blood test or a scan they were getting for something else entirely. So this brings us to the real story here. Why is this even happening? Because as we've been saying, this isn't just a random liver problem. It's a sign of something much, much bigger going on inside your body. Just look at the risk factors and a really clear pattern starts to show up. We're talking about central obesity. So more fat around your middle, problems with blood sugar like type 2, diabetes, high blood pressure and high cholesterol. Does that collection of things sound familiar? It should. It's basically the definition of metabolic syndrome. And what connects all these dots? There's one single underlying culprit: insulin resistance. It's when your body cells just stop listening to the hormone insulin properly. That makes your blood sugar go up and forces your body to start stuffing fat into places it doesn't belong, like your liver. This is the engine driving the whole problem. Okay, so we've established it's a metabolic problem and the liver is just where we see it. But now we're going to pivot to the most critical part of this whole explainer. The number one danger for people with MASLD is not what you think it is. Seriously, take a second and think about it. For all the people out there with this condition, what is the thing that is most likely to kill them? You'd think liver failure, right? Or maybe liver cancer. Nope. The answer is cardiovascular disease, heart attacks, strokes. That is the number one killer. The liver isn't the victim here, it's the messenger. This changes everything. Tackling MASLD isn't just about saving your liver, even though that's obviously a good thing. It is absolutely critically and urgently about protecting your heart. That reframes the entire conversation. But here's the really good news. This is not a life sentence. In many cases, this condition is totally reversible. So let's get into the actual actionable steps you can take to fight back. Get that fat out of your liver and slash your cardiovascular risk. All right, first up, a clear and totally achievable target. The science shows that losing just 5 to 10% of your body weight can make a dramatic difference, reducing both the fat and the inflammation in your liver. That's a powerful goal to aim for. And here's another super simple, really powerful number to know your waist to height ratio. You want to keep that number below 0.5. It's a fantastic way to track the kind of central body fat that really drives this problem. So what's the game plan? Look, It's not some crazy fad diet, it's a sustainable lifestyle shift. Focus on foods that are high in fibre and low glycemic. You got to cut way back on refined sugars and processed carbs. Get enough protein so you don't lose muscle, and get moving. A mix of cardio and strength training is perfect for improving how your body uses insulin. And of course, while alcohol doesn't cause this, drinking too much can definitely make it worse. So as we wrap this up, let's just completely reframe how we think about a fatty liver diagnosis. Don't see it as just an isolated problem. See it as an opportunity. Honestly, this is the best way to think about it. MASLD is your body's check engine light. It's that little warning on your dashboard telling you that your underlying metabolic health needs attention right now before a much bigger breakdown, like a heart attack, happens down the road. So the ultimate takeaway here is all about empowerment. Yes, MASLD is a silent warning, but it's also a reversible one. It's your body giving you this incredible window of opportunity to make changes that will protect not just your liver, but much more importantly, your heart. Which really just leaves us with one final question for you. Now that you understand what this silent signal really means, what message is your body sending you?